Okay, that is reproductive health lesson onwards, the continuation of that in zoology. Lesson 3, medical termination of pregnancy, MTP. Okay, so if voluntary the parent it is abort means the yearly pregnancy, it is very safe, it is non-surgical method and or a non-invasive way it has happened. And but later second trimester it is very risky for that in a fetus and also in a maternal tissue. So government of India legalized MTP in 1971 for medical necessity and social consequence with a certain restriction like sex discrimination and illegal female feticide to avoid it misuse. So MTP performed illegally. ஃபார் எக்ஸாம்பிள் இல்லீகலாக வந்து இதை அவாய்ட் பண்ணுறாங்க. பட் ஆனால் பேபி க்ரோத்து சரியாக இல்லை அப்படிங்கிற டயத்தில் வந்து but the doctors it is recommended that in a medical termination of pregnancy. So MTC it is performed illegally by unqualified quackers, is unsafe and could be fatal. Fatal means it is in a very dangerous. Okay, MTP of first conception may have severe psychological consequence. It is so that is an approximately half of unindented pregnancies are due to that in contraceptive failures, largely owing to inconsistent or incorrect use of that in contraceptive methods. The effectiveness of long-acting reversible contraceptions is superior to that to that of contraceptive piles, patch or ring, and is not altered in adolescents and young women. Educating young women about the usage of intrauterine devices and contraceptive implants would dramatically reduce the use of unintended pregnancy among women seeking family planning. Okay, so next topic is sexually transmitted diseases. What is that in a sexually transmitted diseases? All vulnerable diseases or reproductive tract infections. So all those things it is mentioned as in a sexually transmitted infections. Okay, sexually transmitted infections. Normally STI or transmitted from that in a person to person during that in a intimate sexual contact with an infected partner. Okay, infected partner one through that only it is transmitted. The infection like hepatitis B, HIV or transmitted sexually as well as by that in a sharing of infusion of needle ஷேர் பண்ணுறனால சர்ஜிக்கல் இன்ஸ்ட்ருமெண்ட்ஸ் வந்து ஷேர் பண்ணுறனால இன்ஃபெக்டட் பீப்புள் வந்து பிளட்டை வந்து ட்ரான்ஸ்மிட் பண்ண கொஞ்ச நாளைக்கு முன்னாடி அந்த மாதிரி வந்தது இல்லையா. கொரோனா இருக்கிறவங்க வந்து ட்ரான்ஸ்மிட் பண்ணுற எய்ட்ஸ் இருக்கவங்க வந்து ட்ரான்ஸ்மிட் பண்ணுறனால சைல்டு அந்த மதர் போத் ஆர் கெட்டிங் தட் இன் எய்ட்ஸ் லைக் வைஸ். எஸ், people in the age of 15 to 24 years are prone to these infections. The bacterial STI in what are the bacterial STI means gonorrhea, siblings, syphilis, and chancrot, chlamydiasis, and lymphogranuloma venom. So viral diseases likewise in genital herpes, genital warts, hepatitis B, AIDS, trichinosis, and protozoa, and candidiasis is a fungal STI. So it is asking that in a 2 mark means you just mentioned that in a these alone, but it is asking us in a detail what is that in a viral infection, viral STD, and then bacterial STD means you want to write as in a very detailed manner. Okay, so virus cannot be treated, but the symptoms can be controlled by the antiviral medications. So and also lattice condoms usually it is greatly reduce the risk, but does not completely eliminate the risk. Okay, eliminate பண்ணாது பட் ஆனால் reduce பண்ணும். Prevention of STDs. So இதை பார்க்குறதுக்கு முன்னாடி we have to know that what are that STDs, bacterial STDs, STI, that is STDs means sexual transmitted diseases. It is a sexually transmitted infections. So that is what means gonorrhea, syphilis and chlamydiasis, லிம்போகிரானுலோசா வெரினம். ஸோ இது வந்து எது காஸ் பண்ணுது அப்படின்னு பார்த்தோம்னா, ஃபர்ஸ்ட் ஒன் gonorrhea. It is caused by that Neisseria gonorrhoeae. It affect that urethra, rectum, throat and female cervix also get infected. ஓகே, ஸோ இன்குபேஷன் பீரியட் நம்ம பாடியில் அது தங்கி இருக்கிற நாட்கள், அதாவது அந்த சிம்டம்ஸை க்ரியேட் பண்ணுறதுக்கு முன்னாடி வர ரெஸ்டிங் ஸ்டேஜ் இன் அவர் பாடி. ஓகே, ஸோ அது வந்து நல்லா அதோட கவுண்டிங்கை ஃபுல்லாக இன்க்ரீஸ் பண்ணிட்டு தான் என்ன பண்ணால் நமக்கு சிம்டம்ஸை வந்து வெளியில் கொண்டு வரும். ஓகேயா, ஸோ அந்த கண்டிஷன் நம்ம என்ன கால் பண்ணுறோம் அப்படின்னா இன்குபேஷன் பீரியட். ஸோ வாட் இட் இஸ் காசஸ் மீன்ஸ் இட் கிரியேட் எ பெயின் அண்ட் பஸ்ட் இட் டிஸ்சார்ஜ். பஸ்னால் சலம் வைக்கிறது அண்ட் ஜெனிட்டல் ட்ராக் அண்ட் burning sensation during that urination. This is all it give by that gonorrhea. And syphilis, it is also one of the bacterial disease infection. Trypanosoma pallidum, that is in a primary stage. Now first at the starting stage it is having that painless ulcer of that genital external genitalia, and the secondary stage it is skin lesions, rashes, swollen that joints and fever, hair loss likewise it is created. And tertiary stage in appearance of that chronic ulcer, nose and அல்சர்னால் சின்ன சின்ன குட்டி குட்டி புண்ணு. ஓகேயா, ஸோ அதை க்ரியேட் பண்ணும். அண்டு லோயர் லெக்ஸ் அண்ட் பேலட்டில் வந்து க்ரியேட் பண்ணும். லாஸ் ஆஃப் மூமெண்ட்ஸ், மென்டல் டிஸார்டர், விசுவல் இம்பேர்மெண்ட், heart problems, gumas likewise it is created. It is incubation period 10 to 90 days. Next one is the chlamydiasis. It is a chlamydia trachomatis. Trachoma, it is affect that the cells of that columnar epithelium in that urinogenital tract, respiratory tract and conjunctiva. So in this condition it is occurred by that in 2 to 3 weeks or up to that in 6 weeks it is having that in incubation period. Lymphogranuloma verenea, it is in a glandia trichomonatis, that is in a cutaneous or mucosal genital damage it is created. And urethritis and cervitis it is created. Locally harmful ulceration and genital elephantiasis it is created. Okay, so next one viral, it is viral STI we have to check. It means that is genital war, hepatitis B, AIDS. Genital herpes, it is created by the herpes simplex virus that is sows in and around the vulva, vagina, urethra in female, or source on around the penis in male. It is created. Pain during that urination, bleeding between the periods and swelling in that Korean nodes it is created. Okay, 2 to 21 days it is in incubation, but after only it is created that symptoms to us, these symptoms to us. Okay, next one is the genital wart, human papilloma virus. It is what are the symptoms it is create means hard outgrowth as tumor. It is created in external genitalia and cervix and perianal regions. It is created 1 to 8 months it is having that incubation time. Okay, next one is a hepatitis B virus, that is HBV. It is create that in a symptoms of fatigue tinnitus, jaundice, fever, rashes and stomach pain. It is created. Liver cirrhosis Liver cirrhosis means liver enlargement, and liver failure occur in the later stage it is occur. Okay, so its incubation period பார்த்தோம்னா 30 to 80 days it is having that in a incubation time. Next one is AIDS, human immunodeficiency virus, enlarged lymph nodes, prolonged fever, prolonged diarrhea, weight reduction, and night swelling. It is night sweating. It has happened 2 to 6 weeks, even more than 10 years. It is occur that in a incubation time. Next one is a fungal. It is in a candidiasis, Candida albicans, that is attack mouth, throat, intestinal tract and vaginal itchings and soreness, abnormal vaginal discharges and pain during the dinner urination. It is in a fungal attack it is give. And trichomonasis, it is in a trichomonas vaginalis, it is in a vaginitis, greenish yellow vaginal discharge and itching and burning sensation, urethritis, epididymis and prostatitis. It is created. It is incubation to a time is a 4 to 28 days. Okay, so these much of diseases it is affect, how it is able to prevent. Okay, வருமுன் காப்பதே சிறந்தது இல்லையா. So avoid sex with unknown partner and multiple partner, and then use condoms. In case of doubt, consult a doctor for a diagnosis and get complete treatment. This is the preventive method. It is asking in a 2 mark. Okay, so it is also one of the important question. This is also one of the important question. Okay ma. So and next one is the cervical cancer. Cervix, it is in a female. Yes, it is in a tract of that in a reproductive organ for in a female. Cervix cancer is caused by that in a sexually transmitted virus called human papilloma virus. HBV may cause abnormal growth under cervical cells and in a cervical dysplasia. The most common symptoms and signs of that in a cervical cancers are pelvic pain, hipல வந்து pain இருக்கும், and increased vaginal discharges, and then abnormal vaginal bleeding. Okay, so that likewise it is having means you must be want to that in a take care in a female, that is it is able to cause that in a cancer. Okay, the risk factor for cervical cancer includes multiple sexual partner and a prolonged use of the contraceptive piles. Okay, so that is it is created. So cervical cancer can be diagnosed. How we are able to diagnose means Pavenu smear combined with an HBV test we are used, and X-ray, CT scan, MRI, PT scan may also be used to determine the stage of cancer. The treatment options for in a cervical cancer include the radiation therapy, surgery and chemotherapy. Cancer, like all the cancer doing, likewise it is also done. The modern screening technologies can be detected for in a pre-cancerous changes. So what are then in a modern therefore screening முன்னாடியே நம்ம ஃபைன் பண்ணிட்டோம் அப்படின்னா 30 years once in a year we want to must be check up. Cervical cancer is prevented within a vaccination. ஓகே, வேக்சின் போட்டால் cervical கேன்சரை வந்து நம்ம ப்ரிவெண்ட் பண்ண முடியும். 9 to 13 years in a ஏஜ் இந்த பேப்பிலோமா வைரஸ்காண்டி நம்ம என்ன பண்ணணும், we have to take it as in a this papilloma virus for the purpose we are take it as in a vaccine, means we are able to avoid that in a this type of cancer. Okay, because it is in a viral infection only, so it is created likewise. Avoiding tobacco usage. ஸோ இதை என்ன பண்ணணும் அப்படின்னா இதை எப்படி ப்ரிவெண்ட் பண்ணலாம். ஃபர்ஸ்ட் ஒன் ஹெல்த்தி டயட்டு, நம்ம சாப்பிட்ற சாப்பாடு வந்து நம்ம பாடிக்கு ஹெல்த்தியாக இருக்கணும். செகண்ட் ஒன் அவாய்டிங் டொபாக்கோ யூசேஜ், we may never be used to that in tobacco products, and preventing early marriages, and practicing that in a monogamy. monogamy, we have to avoid that regular exercise and minimize the risk of that in a cervical cancer. So these are all those things, it is reduce that in a cervical cancer. So next one is in a infertility. We see it in the next video it is.